Good afternoon. This is Lucia from South Sudan. Thank you.
Okay, good afternoon. This is Andres. I am one of the regional leads of the European region of the National Challenge. I will be leading the session along with Marta Ferraz. I will be presenting her a few minutes later, but I just wanted to say that many thanks for joining us. And if possible, we will wait a couple of minutes to start the session because more than 100 people were registered, but sometimes not all of them join the session. But yeah, we can wait like at least a minute. And please, if you want to share where you're from, where you're based in, or where do you work at, that would be great. To have an interaction, a great interaction among the audience. Hi, Lincoln. He's one of the other regional hub leads, Malgorzata.
Okay. Hi, Andres. Good.
Nice to meet you, Lincoln.
Nice to meet you all. Thank you.
Well, I think I'm okay. We can start right now. We have a tight schedule, so let's make sure that we take advantage of the time. Okay. Many thanks for joining us. This is a part of the Euro Region Challengers Committee. We were thinking, Malgorzata and Lincoln and I, who are hub leads from the Euro Region, we were thinking that this topic, artificial intelligence and innovation in technology field, was something very important. It's something that is a topic is growing every day, and you will notice that after the presentation. And we would like to share, we were thinking that it could be great to share this topic with you all and to invite some speakers that can set light about it. So I will be leading the session. Marta Ferraz, she's another Challengers Committee member from the Euro region. She is a PhD, she's a nurse, head of the quality unit at the University Hospital of Navarra and lecturer at the Public University of Navarra and member of the InnoCare Research Group. We will have a part in the session to ask some questions. So Marta will be asking some of the questions, and then she will be moderating part of the questions from the audience. If you would like to put in the chat some of those questions, she and I will be taking notes about those questions, and we will have some minutes if you would like to jump in and just share those questions with the camera open if you want. Okay, so we have invited Ernesto and Jordi. Ernesto, he has a background in nursing. And then he moved to work as a nurse in Dublin, in Ireland. And then he started to work in the field of artificial intelligence. And he is now CEO of an academy, Artificial Intelligence Academy, Open Academy. And he is CEO of the Irish headquarters. But he can explain it better. And then Dr. Jordi Serrano, well, Dr. Serrano has long experience in this field. He is a medical doctor, a family doctor. That's his background. But he started quite soon to be involved in innovation in healthcare. He founded, he was the first CEO and founded the Universal Doctor, who was, let's say, his first baby in some way. But he has founded some other things. He was co-founder of Planet Health Innovation Network, and he is now International Innovation and Research Advisor in the Sant Joan de Déu Pediatrics Hospital from Barcelona. He has founded also Huda Health, and he has been working for the WHO. He's now in Doha, for example. So he does a lot of consultancy for international organizations and international and big hospitals. So Ernesto will be the first doing his presentation, and then we will move to Jordi Serrano. After that, we will be doing some questions. We will be asking them some questions about the presentation and some of the questions that Marta will ask, and then we will have some space for the audience to ask those questions. So please, Ernesto, go ahead.
Hello, everyone. Nice to meet you all. Thank you, Andres, Marta, for having me here. It's a pleasure to be in this webinar. So if I can, I'm gonna share the screen. I think I'm able to do that. Let me see. Can you see my screen right now? Yeah, okay, Andres. Great. Thank you. Thank you, everyone. I'm gonna move this here. Okay, great. So as Andres said, my name is Ernesto, and I'm a nurse, and I'm also director of the IRIS headquarters of eAcademia. eAcademia is an artificial intelligence consultancy, and I'm also CEO of AI Open Academy. I'm based actually in Dublin. So yeah, thank you for having me here. And I would like to talk about why is AI important for nursing? So let's dive into it. Let me see. So first of all, I would like to talk about the problem, and after we can talk about the solution, because the problem is that you can see already the population pyramid. It's the shape is really interesting because we can see the pyramid is wider in the middle. It narrows on the top, of course, and it narrows on the bottom, and it shouldn't be like that. Okay, so we are reversing. We can see that the pyramid is reversing. So the thing is that someone is going to take care of all these people when they are retired. And the thing is that we are not going to be enough people to take care of everyone. That's a fact, okay? So we are starting to see healthcare facilities overwhelming. If I go right now to the hospital in Dublin, to the emergency room, I could wait like 6, 8, 10 hours. Also the waiting lists in Spain, if I go to the hospital, I could wait like, of course, not for surgery, for example. If it is not an emergency, I could wait like 6 months, 8 months. So we are starting to see some really big problems. And also we are starting to see like we are offering less quality of care because there are a lot of people, we are not so many healthcare workers. And in last year in Spain, they did a research and they found that we are 346,000 nurses in Spain, and we need 100,000 more nurses in Spain. So yeah, we need more people to take care of everyone. And almost 40% of those nurses want to live in the next 10 years. Of course, because of the pandemic, everyone is so tired, and half of them believe that there is not enough quality of care actually in Spain. Okay, so what's the solution? We could say that, of course, more nurses, better paid, but I would like to talk about technology, and it could be a solution. Actually, artificial intelligence can be applied to healthcare. There are so many applications of artificial intelligence, but I would like to talk about the ones that can be applied to nursing. Okay, so because I'm a nurse and yeah, I'm really focused on that field. Okay, so let's start. I would like first to talk about AI scribes. What is an AI scribe? Okay, so this is a machine powered by artificial intelligence that listens, transcribes, and includes all the information in a meeting in the patient history. For example, if you are with a patient like 15 minutes, half an hour, it's completely impossible that you remember everything the patient said. Okay, if you have a computer in front of you and you type while the patient is talking to you, of course, you could have more notes, but that's not the point, right? The point is that we could listen the patient like, and he could feel listened, you know, because in Spain, a lot of people complain that when they go to a doctor or when they go to a hospital, like everyone, all the healthcare workers are in front of the computer. So this could be a solution. They could reduce the documentation time. The healthcare worker could focus more on the patient, and we could do less paperwork because 30–40% of the time of the nurse is spent on paperwork. So here we can see that we are humanizing care through AI. This is a great example. So here I think you all know Microsoft is a big tech used in United States. So Microsoft has developed some AI solutions for healthcare field. You can scan the QR if you want to go. Now we will go. So this solution, it's like Dragon Copilot. Dragon Copilot is an AI scribe. It's a software that can be implemented at the hospital, the healthcare center, or your clinic, wherever. So if we go there, I think I have it here. Yeah, you can explore all the benefits that has this type of solutions. You don't have to build your own software. You just have to contact one of these companies, big techs, or also startups, and yeah, have this implemented in your place of work. Okay. Another solution that is really interesting is AI assistants. I think we all know what an AI assistant is. We all have used ChatGPT, Gemini, Claude, but I would like to talk about a specific AI assistant, in this case for mental support for chronic diseases. Because when you have a chronic disease, it's really important to listen to the patient, because it's really hard. You're going to have that disease for all your life, and AI assistant can help being available 24/7. You can't have a nurse 24/7 listening to the patient, but this is a great solution, not only an AI assistant by text, but also by voice. There are already some solutions really advanced. You can also personalize support. For example, it's not the same talking with a 20-year-old person, the 60-year-old person, a person from Spain, a person from Africa. It's not the same. You must personalize this support, and AI can do that. Also, you can see the early emotional distress while talking to the AI. AI can detect that through text and through voice. And something really interesting I found out is the AI doesn't judge you, because when you go to a doctor, for example, when a patient comes to me, sometimes I feel he doesn't really trust me and he hides some information. That's normal because I don't know that person. Yeah, AI doesn't judge the people, and people are starting to trust more AI than humans. That's curious. So one example I would like to show you is the one in Spanish Cystic Fibrosis Federation, that this federation has implemented an AI assistant personalized for mental support. If we go to their webpage, fibrosiskistica.org, we can see here the AI assistant is specifically for mental health. Okay, it's Luz IA. IA is AI in Spanish. So this is really interesting because this AI assistant is fed with all the information about this disease. Okay, this is not useful for another disease, but if every federation and every hospital, every unit have this type of solutions, it could be a great solution to, for example, mental problems or some doubts. Imagine that a patient is new in dialysis. Maybe there could be an AI assistant that explain everything, the process of dialysis. It could be great. Okay. So one more thing about mental support, you can scan this QR. It reads a really interesting article called AI Companion Reduce Loneliness. It's published by Harvard Business School, and they measure how AI can reduce loneliness. And in one of the studies, they saw that it is at the same level than humans. Okay, so that's quite interesting. So we need to start and to do more investigation in this field. Okay. So let's talk about now AI agents, because it's not the same an agent than an assistant. Okay, the main difference between agent and assistant is the autonomy. An agent is much more autonomous than AI assistant. Okay, it's a ChatGPT, you need to talk to him and then he answers. But an AI agent, you can give them orders and they will do them by themselves. Well, okay, so we already know we are in a shortfall of healthcare workers, but this solution, it's really interesting. It's called Hippocratic.ai, and we will go now to the webpage. And we see there are really so many agents here, okay? And one of them is personalized for one specific case. For example, pre-operation. So when a patient has to go to surgery, of course, he needs to be informed of everything. Okay, so for example, here an AI agent could call the patient the day before and ask him if he has taken the medication, for example, or that he must be he can't eat like 10 hours before the surgery or anything, you know. So for example, for these charts, an AI agent could like talk to a patient after he has been hospitalized and to see how everything is going on. So this is really interesting. I think you should visit this website and see all the type of AI agents that are available. But this is a great solution. Right now, I think it's mostly in English, but it will be in another languages, of course. So the last example I would like to show you is prevention of mental illnesses by video games. Okay, this is a really recent video game. I think it came up like 2 weeks ago. It was launched by Samsung, like the big tech, and also University of Vigo. It's placed in Spain, and the video game is called The Mind Guardian. And it's basically a screening instrument based on AI designed for detection of signs of cognitive deterioration. Okay, so this game is for people over 55 that don't have any sign of cognitive deterioration, and it consists in 3 missions, and it has the results show that it has an accuracy of 97% of detecting this deterioration, okay? Because we know that this illness is the prequel to Alzheimer's, so it's really important to know that a person is having this deterioration. Like if we catch that like 5 years before, it could be a big difference for that person. Okay, so I would like just to finish my presentation, say that AI is not just a tool, it's actually a mirror, because we train AI with our knowledge, with our biases, with everything. And we really need to work on ethics because in the future, for sure, in the healthcare world, it's really, really important. And first, of course, is the ethics, and then to implement everything. So thank you very much for listening to me.
Whoa, Ernesto, what a presentation, and how many examples, how different they are, and it's great it's great to see the different opportunities that artificial intelligence can is showing us. I have just a brief question before going with Jordi. Then we'll have some more questions to ask you both. But I didn't want to forget this one. I found very interesting the AI agents and the difference between the AI assistants. But I have this question. Okay, you can train these machines, this artificial intelligence to answer all the questions that a patient might have about his pathology. But my question is that there are a lot of differences between the type of patients that there are in different hospitals. So what I'm saying is, depending on the hospital where you are, the recommendations might differ a bit between a hospital or another hospital, even though they have the same operation, they have the same intervention. So how these artificial intelligence machines can adapt to the individualities and differences between hospitals, because those recommendations, I guess that they are like they are generalized, but how they can adapt to the differences between hospitals, even though having the same intervention.
Yeah, that's a great question. Actually, we all know ChatGPT, and the model, the LLM behind that ChatGPT is the GPT. And what we usually do when we want to implement an AI assistant in the hospital or wherever, we take the corpus of that LLM and we fed some personalized information. It's called fine tuning. The process is like that. We take an LLM, a model that is already trained, and we do a fine tuning, like a personalized with information of that hospital, that unit, that healthcare center. So I think that's the best solution, because building an AI assistant like from scratch, it's really, really difficult. And I think everyone, I mean, the big companies are doing that. They are offering like these technologies, so we can do like this personalization, you know?
Okay. Okay, thanks. We will get back to you later on with Marta. But please now, Dr. Serrano, go ahead with your presentation and tell us.
Do you see my screen? Yes?
Yes.
Wonderful. So thank you very much. Thank you very much for inviting me. It's a pleasure to be with you here. And what a challenge, no? Nursing. I congratulate you all, because I think nursing is the profession of the future. And basically, there are some key questions transcending AI regarding if AI will finally, maybe in the future, will fusionate probably many of the healthcare workers' profession. No? So we can discuss that later. But basically, if you go to any airport, and these last weeks, all is AI, correct? So I think we are in these busy times, busy world moments where everything is AI. There are many ups and downs, but it is a word that really it's here to stay. No, there are many other words like blockchain and so other that maybe they are not so in a long-term period of time always there, but AI has come to stay, and basically I think it will change our life definitely. Very quickly, my background, I started as a family doctor, very entrepreneur from the beginning, and I launched a company called Universal Doctor, which was a translation tool. And I will use my background a little bit, not to show off myself, but just to explain different approximations to technology. Basically, we started with these translation tools to increase our communication with patients. We did Universal Doctor, but also we did Universal Nurse, because we had a lot of feedback from nurses that, and actually, to be honest with you, now that many doctors maybe don't listen to me, 90% of our tool was used by nurses, so we changed the name. We call it Universal Nurse also. We did that tool also. And we moved there onto that space of technology. Then we went to live to Geneva by some chances, and we started working with WHO in global health and technology, and we became like the digital global health company, and we work in so many projects with WHO and other international organizations. Basically, we ended by working in so many countries, and we work in with different technologies, and we keep moving, creating new companies for prevention and so on. And you will see at the end how important is prevention and why we have focused now in prevention in a new company called P8 Health. Basically, that it's 5 years ago. 5 years ago, that was weekends of family doctors, nurses, some technicians putting together all the buzzwords of the moment. And what is important is not each word by separate, but how themselves they can exponentially transform the system. Actually, it's not it's not odd to see an engineer that starts to study in a polytechnical university, thinking that they will use natural language processing for their own systems, and they end by working in genetics using natural language processing and the algorithms related with them for the thymina, guanina, so the letters of life of the DNA. No, so this is the magic moment where we are right now. No, if we add onto that the planetary health, so all the things that have to do with the environment, with the change that we have produced to our planet, a lot of opportunities, especially for nursing, in regarding how that will affect patients and how many of these things are totally related already. So we have predict how there will be the admissions of hospitals in some days, depending of the weather and so on and so forth. If we put all that together, we can talk about exposome, which is the combination of all the things together. Basically, if you link the different graphics, I like to talk about the opportunities of systemic integration. I will focus on one example of one specific tool we have been developing lately with WHO. But this is it, no? You cannot miss opportunities, and that's why technology is there. To link everything, the nurse role in the A times. I've put different nurses around the planet. Every nurse will need and will be empowered by AI, no? And obviously, AI will never substitute healthcare workers, but of course, you all know the typical sentence. If you don't use AI or you are not into these AI projects, probably you will be not obliterated, but not having all the opportunities that you could have. Statistics very quickly, it's exponentially growing, and basically it will really triplicate or even more, 5 times fold in the next years. Not exponentially what AI will change or systems. Important as the colleague as Ernesto explained very well. What is the problem right now in the healthcare workforce? Probably it's the shortage of nursing, of other healthcare work staff, and this is very important. We know that there are a lot of lack of nurses around the planet, not only nurses, also other healthcare workforces, pathologists, and so on and so forth. I think it's important to recognize that. And for example, I'm going to focus in the lack of dermatologists or people that are aware of how to focus in dermatological aspects in low-income countries. We did a project related with neglected disease and skin disease, because half of the population that affected by dermatology problems in the world will never be attended. So we developed an AI project to, sorry about that. We developed an AI project to support the diagnosis of skin diseases, neglected skin diseases. Imagine we are talking about very neglected diseases where right now in some places there are not anymore the knowledge to diagnose them. And basically we developed this project with WHO and many other organizations. This is an important tool to give engagement, to give educational support, and this is important thing. These tools never try to be diagnostic for the moment, because then the validation process and so on, they would be much difficult to develop right now. We developed this initial app where we slowly embed more resources, and finally we embed a AI tool that we have been testing lately. And look at how many little photographies we had just some months ago. Now we have triplicated in the last few weeks, thanks to these outcomes, where we finally present these outcomes. These outcomes about the sensitivity of the AI module. Basically, this is a CNN. We'll talk about that later very quickly. A CNN, which is a type of neuronal network in that sense. And because of that, we have increased the number of photographies received. And it's important as clinicians, as people that are in front of a patient, to understand all these concepts of sensitivity, accuracy, precision, recall. In AI systems, what it's named in medicine sensitivity, it's called recall. It's not the same exactly. It's related, but it's not the same. We did that. We developed the tool, and basically we were able to implement many of the things and test it in Kenya. Basically, all these things have been changing in the last 7 years totally. Right now, all these tools are more trustable, and they can be used as a support in many cases. And I think it's a demonstration of how these tools can really engage and support patients and healthcare workers in many places. Just to comment, these CNNs, it's a kind of a neuronal networks, and how these tools are working, and how you can train them through a big number of networks of predetermined images, 50,000 images already trained the model initially, and then with our little images, we can customize it for our specific purpose. I will go quickly because this is not the concept of but basically we develop the tool and we are implementing it in many places around the world. And most important, it's collaboration, because if you don't have the data sets specifically from the region with the type of skin and so on, it will never work. Basically, sorry about that. The collaboration is super important, and without collaboration, you cannot achieve many of these photographies of neglected diseases. And this is a way how collaborative efforts can really change the framework. Even now, L'Oreal Group will put 20 million euros to support all these kind of programs. AI for global health, you can see how many possibilities they can be used for global health, speech recognition, computer vision, etc., and how this prevention, diagnosis, acute treatment can be affected and supported by AI, but always with the humans next to it. What is important is that it has changed so quickly. From these slides I was showing 5 years ago to the students, or to explain what is AI, machine learning, deep learning, CNN type of neuronal network. So it's important that no matter how you think that you are lay on the field, it's important that you understand the concepts of what does it mean, because you will find yourself working with many engineers on the field. And it's very important because sometimes they are not very good in understanding the statistics of healthcare. And sometimes you don't have to be impressed by a neuronal network. It's not so far away, a neuronal network, from many of the statistics that you have in learning around your career. So the most sophisticated statistical program, a linear regression, is not very far away of a machine learning algorithm. So I think it's very important to situate ourselves as the final implementers of these tools, because if not, we will lose again the trend as we did with the clinical history many years ago. It's important to understand that. And now we're talking about ChatGPT, and I use ChatGPT to ask it what we should do in the project that we have been working many years. No? So you can really, and it has really done it quite well with the ChatGPT, and it has really validated what we have been doing with wonderful professionals during the years. But basically, now this is a kind of a LLM. I will not focus, but you can, I will share the screens later. But basically, we talk about now LLMs. We talk about, it's important also to understand the concepts. What does it mean? How they can be improved, etc., and how big they are, these models, and how they can combine with other modalities to develop new types of AI. And basically, ambient artificial, a type of combination of how we can interact with the patient, with AI, and so on and so forth, and how it will help us, especially in the nursing field, how that can really improve the relationship with patients. How can they monitor if you are with infrared waves plus ambient artificial intelligence? You can really monitor if you are really washing your hands before entering into intensive care unit, for example, and that will really revolutionize the healthcare, etc. The colleague also was talking about the agents. Absolutely. How these agents, sorry, this is in Spanish, how these agents will change. This is the difference between the agents, the generative AI, and the AI, agentic AI. Okay, I think I have it. No, I don't have it in English. Sorry about that. But basically, the agentic AIs decide in an autonomous way once you give them the orders. How we can use that in the flows, super important. Again, in the role, with all that, what can we do? Many things, no? Many nurses are working with many teams, developing AI tools for many specific purposes. So in that sense, we have an endless list here. And basically, our colleague, I look for it, Ernesto, congratulations for your programs, AI for teaching, for learning, etc. Also, here we have these voice recognition tools that Ernesto also was talking, many things. I'm happy to also collaborate as a consultant with Sant Joan de Déu Hospital in Barcelona. The Cortex, the tool that monitors many of the data of patients, it's like an immense tower of an airport, really monitoring the hospital. No? And who is leading more of these monitorizations? A nurse in chief. No? So hospitals will be monitored by nurses in chief, probably leading all the monitorization of the hospitals. I think it's endless, the possibilities that gives to the nursing field, and how you will decide which beds will have to be empty for tomorrow, etc., and how you will control the flows of the hospital. No? Many of these projects that have been implemented there really reduce the operative cost of the hospitals, and nurses are the key, the element of these tools. From educational purposes to diagnosis purposes, many blood pressure instruments, tools can be, they can facilitate your life to not spend many minutes with patients for things that can be automatized, etc. Digital therapeutics, also treatments. Remember that all these tools must be validated according to the new MDR regulation, etc. So some of these tools can become like a drug. They are a drug. They are a digital therapeutic. No, slowly they will be incorporated in our workflow. Personalized medicine, just to finish. Basically, the potential of AIs to monitor biomarkers with cardiovascular risk and so on, it's immense, and that's why in our new company we have developed, it's called P8 Health. We are doing amazing prevention consultations of 2 hours. Important, the patient can be visited during 2 hours. We are doing the P8, which are the 8 Ps: personalized medicine, proactive medicine, predictive medicine, preventive medicine, participative medicine, important, talking planetary medicine, primary, which is very important, and with purpose. And even you have more Ps, which you will have, no problem. The 8, it's kind infinite also, so all the Ps of the wall to improve the patient outcomes. And in that sense, we have 2 hours room where we listen. So all the technology, the most important thing are the SOFA. The SOFA, 2 hours speaking with the patient, screening them using AI, and finally having the educational personalized test and a final specific AI tool to really edit the interventions and give them the right interventions for each specific person. This is the P8 Health, and basically also to commend you that you are invited to a conference we're going to do soon in Rome about the planet, innovation, and so on. And most of the last conference, most of the attendees were nurses. So I think you are an important pillar, a very important pillar of healthcare, and you should be leading the AI, because AI will be the tool that will change the bed of the patient, and in the bed you are essentially the master. By the way, in the conferences, please remember to also go to conference where they offer healthy food, important for our health future. And basically, if we collaborate together, the future will be brilliant. And I'm pretty sure that AI will fusionate doctors and nurses in the future. I'm pretty sure in 50 years, there will not be probably a profession called doctor and nurse. I think it will be a mixed profession. Thank you very much. Thank you.
Well, Jordi, many thanks for your presentation. It's amazing. Well, not only all the work that you have been doing. I don't know if can you hear me well, because I'm in a room with more people, but it's amazing all the work that you have been doing. And one of the things that I like the most about Jordi is that he's one of the best, he's one of the persons that promotes more the nursing profession, even though he is a medical doctor. He understands the potential that nurses can do for the good of patients. So because he understands maybe our holistic approach, and as we are final implementers of most of the things, especially when it comes to taking care of them, he understands the potential that we have. So this has been a very good presentation to know that, and to get to know, along with Ernesto's initiatives, your initiative. Okay, so Marta will be asking some questions now, and then we will ask you some questions from the audience as well. So please, if you want to write anything in the chat, please do so there. And if not, you can ask the questions after Marta and me, with the micro open.
Yes, thank you, Andres. Good afternoon, everyone. We are delighted to have these two exceptional speakers here today, sharing their perspective on the fascinating world of artificial intelligence. Please join me in expressing our sincere thanks to Ernesto Ibañez and Jordi Serrano for taking the time to be here and share their experience. And now we open the door for your questions. So please feel free to write any questions you may have. For my part, I would like to ask you, in what areas can a nurse develop AI initiative in a care setting, whether hospital or primary care, or what areas to improve care could be working on more now with AI?
Well, I think, in my opinion, one of the best areas where we can start as nurses or healthcare workers is in education. Education for new nurses, education for the patients, because the most difficult thing to implement technologies in the healthcare world is the data privacy. So if you have not so many resources, you could start with the education, and then you can move to the hospital. For example, we were talking about before AI assistants. It's not really difficult to contact with one company, so they can install all the software in your hospital. But that's more difficult than education, in my opinion. Yeah.
Okay, thanks. And what training or competencies should nurse develop to lead innovation in artificial intelligence?
Should I talk? Jordi, do you want to answer?
Yeah.
As you wish, Andres. Start.
You can both. You can both.
Yes.
You can both answer two questions, because Jordi, if you have some comments about about the previous questions, you can go ahead, and you can both answer both questions.
No, thank you. I think that Ernesto is very focused in education, and I think this is fantastic. I think it's primordial education, because governments have always, without intention, or I don't know, but neglected education, no? Because at least not probably the university education, because but the post-university education, no? At least many nurses and doctors, especially and nurses, maybe they have lack this capacity that many doctors have had with the pharma industry, no? To keep with the postgraduate education. I think there is a new time now for education. I agree with Ernesto. I think it's a huge possibility. But also, I am a little bit also biased from my side. Primary care for prevention, no? It's the point. If we really believe that everybody has the right to live as long as possible and as healthy as possible, we hope we can keep that at least. Then the prevention aspects, the value-based care of the implementation of medicine with outputs before, it's clear, you don't have to be a science Nobel Prize to understand that if you prevent, you will save huge stones of money. No? And to prevent, the politicians must understand that all these value-based care programs of prevention, of following the diabetic patients, and which actions have changed their behavior to reduce the glycosylate hemoglobin, and to reduce, because of that, at the end, the renal failure the amputations, the diabetic feet, whatever, you start counting all that, it's immense, no? And for that, you need AI for prevention, no, processes, no? And yeah, and I think that we did very wrong at the beginning of the medical history electronic record implementation 25, 30 years ago. Now there's a huge opportunity for nurses and for doctors to lead the new implementation of AI. And it cannot be repeated, the same errors of 30 years ago. They shouldn't be repeated, no? And the what nurses, especially nurses, are protesting of burnout, lack of resources, not continuity of long-term contracts, all that, the main problems, they should use the prevention of the systems using AI, lead by them, to talk with the government and say, look, we are reducing the cost of the system because of that, but we must lead that, no? So I think it's important, no, to change everything.
Yes, yes. I think prevention is a key to reducing expenses and improving the condition of patients. Yes. Okay, and in the second question, what training or competencies should nurses develop to lead innovation in artificial intelligence?
Well, I think, of course, technological abilities are really important, but I think one of the most important things are soft skills like adaptation, discipline, because I think all those abilities are not really common nowadays. So I think everyone should train that. And with that base, I think, and a bit of education in AI, you don't have to be like an architect, like an engineer or something. You just have to know the basis of the artificial intelligence, and with that, you can work with an engineer to develop some AI tools that can be implemented in hospital, healthcare centers, or everywhere, actually.
I agree. The interface are changing so quickly, and it will be, that right now the soft and the more empathetic people will be more required. That more mathematical, people that there are some people. I do not agree with some people that are always classifying patterns. No, people are more mathematical, more less social, which is not always the case. No, but there is a tendency. But right now, the empathetic capabilities will be more required in some companies, and basically, it's the capacity to understand your own business, your own healthcare field, and quickly think how to implement these tools, in there. And again, in these times of change, you having the right knowledge of the minimum terminology, what does it mean, how to interact with the engineers that are implementing these tools, to enter and engage yourself in projects and say, look, I think our data is biased. Is data only of white men? Still is there. Is that the problem? So I want to engage in the project and add more data of women, Always the same. There are a lot of lacking data of women in many of these projects, data sets and so on and so forth. So this kind of engagement in the processes, it can really give you a possibility to be a leader in the future because we don't know what will come, with what will come, it's impossible to know. So.
Okay, we have one question from Nathia Ilias, and she said, is there any AI?
No te preocupes. Chao. Is there any
Yes.
AI that can generate
AI.
nursing process by listening to patients 24 hours? From Natia. If you agree, for example, we will be asking one question to every speaker. So, for example, Jordi or Ernesto can answer this one, and then the other one can answer the following question, and like that. And please, if you want to raise your hands, yes, do so. because we love face-to-face interaction. So, okay, but we will start with Nadia. That was the first question.
A tool that listens the patients 24/7, you're asking. Well, first we need to talk about if that's ethical, because recording the patient all the time might be not ethical. The patient might not agree. But yeah, as we talked about before, AI scribes that can listen to the patient specifically while they are talking to the nurse or to the doctor, I think that's a great implementation. Maybe AI assistants not recording all the time the patient, but if the patient is lonely, they can talk to the AI assistant and maybe detect some patterns of, for example, depression, of any other. I think it would be a great implementation, but I'm not sure listening the patient all the time, but specific time like when he's talking to the doctor or to the nurse, I think it's great.
Okay. Okay, let's go with Jordi. We have another one from Gracie. Well, maybe you have answered some of parts of some of these questions, but what are the best ways to combat misinformation and ease fears that nurses have about integrating AI into practice?
Well, misinformation, obviously, the velocity on how AI, the new platforms, the new LLMs can really produce good content, apparently, no? It's very difficult to control. So the organism, medical colleges, ministries of health must really set up new kind of certifications and really support, no? What is the final outcome of all these new text, content, etc., etc. I believe that, as Ernesto said before, there will be some validated soon LLM, no, framework where this content, this basic content is already, no, it's already valid, it's already whatever, and from that you can customize for your hospital, for your thing, for whatever, no. But it's very easy to really misinform people because the lack of knowledge in even in grammar, in whatever, it's not the same because of the causality, no, and it's not the same causality and correlation, and most people do not know, no. So like that, it's so easy, no, to really misinform. So I think it's about education. They don't pull your leg, no, because it will be one of the problems with AI. They will pull our leg sometimes.
Okay, completely agree. And maybe if we could start part of this training in academy, so in academia, in the university, that would help nursing students to understand what are the benefits of AI and how could they implement AI and do not have this kind of fear about using it. But we all know that it's something quite new for us, and there's still a lot of things that we don't know. So I understand that maybe people might have some fear. We have first, before Sana, we have some questions from Lincoln. So as he has opened the camera. Go ahead.
Yeah, you don't have to read the chat, Andres. Thank you very much. Jordi, Ernesto, Marta. I mean, you're just leading the way. I mean, let me just be. You just blow my mind. As somebody who's very well versed in the AI world, thank you, amazing. You're leading the way. I'm not gonna go ask other questions. I think there's just one question I'll ask: how do we protect the NERS title? Because everybody's using the NERS. I'm seeing NERS Scribe, NERS this. So here in the UK, we've got a massive campaign going on about protecting the NERS. The name, the title, because people feel like I'm a practice educator myself. People feel like they don't want to be replaced by AI. They feel like AI is going to be taking over their jobs. So how do we protect our title, NERS?
That's a really good point, Lincoln. I think if like 20 years ago, as Jordi said, with the electronic system, we lost some humanity. So I think if with AI, we can show the world that we can improve that humanity and we can like forget a little bit about technology, computers, and talk to the patient and improve that humanity, I think that would be great. Like to show not only with words, but with actions.
Yes, thank you.
In any case, I believe that it's a balance between protecting the jobs that already exist, but the jobs must understand the different professionals must understand that the frontiers that before were very blocking between the should be a little bit more open, because it's always the same. Every healthcare profession fights to have their own space, and we could stay here in another big debate, no? I totally think that the nurses should be able to prescribe medication, and we could start here an endless debate, no? But other doctors do not believe that, and then you don't believe that your colleagues in your profession, some of them, take on responsibilities that you wanna. The question is, this AI transversal, when we will have general AI machines, not specific AI, but general AI, which will be robots acting as a human. Imagine how we'll have to handle and be flexible about what AI system can do or not. So there will be always the humanity behind the other humans wanting to be treated by a nurse in this case, no, before than a robot. And the nurse will be able to focus in finally very, very, very gray matters. So what now you believe that AI will really stop you deepening in calculations and things, well, AI will force you to produce more elaborate thinking, unethical and human, to be next to the patient. So I believe that people has this misunderstanding. Oh, I don't have to study to train myself, because now, well, what happens when the AI one day plugs off? No. Second, what happened when? So I mean, for me, it's the contrary. We have to be more prepared than ever, because AI raise or bar. If now I give you 1 hour of time, you can make with AI a presentation that could really emulate my presentation or even better. Well, so every of us must be prepared for faking, for simulation, or for understanding that you can be very good in very little time. And the others must accept that also. So I believe it's a huge change of mentality, and the people who are really very chameleonic will thrive. I suffer for people that are really, really, really rigid. I think it will be a problem for them, but I hope they can really understand the potentiality.
Yeah, thank you. You've answered my questions. Yeah, happy to catch up, at some point. That's a follow-up. Thank you.
Yeah. Andres, you are muted.
Yes.
Sorry, I just wanted to say, yeah, completely agree with that, Jordi. I think Sana had raised her hand. Okay.
Thank you.
And then we will answer a question from the audience, and we will move to the final part of the session.
Okay, thank you, Andres. Hi, Ernest and Jordi. Thank you so much for coming. It was amazing, and I'm blown away. Thank you. And today, my takeaway from this session would be AI is humanizing the healthcare, which we thought, like, we spent so many hours documenting what the patient is saying, and if I see that AI would be describing that, I can see, like, I can make eye contact, I can talk to them, and it's actually humanizing. While when we talk about AI with fellow nurses, nursing students, and midwives, they are more like it will dehumanize it, but it's the other way around. So I think this is the biggest takeaway. But my question is, I'm more into like knowing about the risk of data. when nowadays, when we see, like, for example, we're talking about something and suddenly in the Facebook and everywhere we see the advertisement of the same thing we talked about. So it's more like that technology is listening to us and there's no privacy. So if we are going to into big data and using AI and softwares in the patient's data, for example, and discussing the patients, and AI is scribing them, how do we make sure that that confidential data is actually protected?
Actually, if you have, for example, as we said before, there are so many companies that offer this kind of softwares. So you have to make sure you contract and you pay the right company. And there are some data privacy, I don't know, some titles that must be in the AI tools that can be implemented. I mean, the AI must have some titles or some information that knows that AI is right. So I don't know if I'm explaining myself correctly, but you just have to make sure that the company is right, and even if it is a startup, and you have to check the regulation in your country. For example, it's not the same regulation in the United States with the FDA, and in Europe with the AI Act, and the rest of the world, I'm not really sure the regulation, but you have to make sure the company has everything in order with that. You're mute.
Oh, Jordi.
Sorry, no. Totally supporting what Ernesto said, but very quickly. At the end, it's unstoppable. We have to make ethics where we say, look, all this data, because it will be there anyway, no? Will have to be managed in a way, no? That all the companies, no, must follow these standards and so on, and everybody. And second, don't think that we have to really, if we want to be thriving in this new environment, we have to accept different things. First of all, our DNA data is not the important one. More important, the proteins, which are dynamic. Your proteins are changing every 15 days or every 2 days. The DNA is always the same. So DNA is shared by everybody in the planet. We know already everyone. Second, there are technologies to protect us. For example, if we have a video camera in your bed to really use AI to know the movements and to save life, that is very nice. But maybe we have to use a camera, not with an image to protect your images, but with thermoregulation. And can be AI used in thermoregulation in the same way than a normal image? Probably yes already. So there are already technologies to solve the problem that I want to really record you in the intensive care unit to save your life. But then because of that, I have a video of you. Well, this is not for anonymity, it's not good. So technologies, ethical, and acceptance that your data, if you want to live in the 21st century, will be in a server. You can leave everything, you can go in the middle of the jungle, and maybe you are happier. But I don't know if that's possible, sadly. I would do it, but it's not possible.
Perfect. Okay, so we are going to move to the final part of the session, but before doing that, there's a question from Prutras we have not answered yet, but as I am working at the hospital, and I have finished right now, before the session, my shift, I think that I can answer this one. So she asked, being a nursing student, I was thinking if the AI is coming in nursing, it can somehow reduce the workload on the nurse. But when we come on the care of the patient, how can it help us? And she says this because of every patient type is different and every patient body is different to another. So how it can help us because it has same data fitting. So just to summarize it very quickly, but maybe Jordi and Ernesto would agree with me that one of the best things that AI can do for us is that AI can save us time, and AI can save us time by gathering all this data and having a better control for patients. But we will still need probably to take care of our patients with our hands and to personalize to every patient the different needs that they might have. So the best thing that AI can do is to save us time to control everything better because everything is monitorized. But we will still need to take care of them with our hands, to be with them and to personalize like the different things that they might have. So yeah, AI is improving a lot, but they need us. They need still nurses and healthcare workers to personalize at the maximum and to be with them. And AI cannot supply that. Okay, so we will move to the conclusions with Marta.
Yes.
I don't know, Marta, did you want to ask them the final ideas before conclusions? Or...
I have only one conclusion. One of my conclusion is that artificial intelligence has infinite potentials, and we must begin to explore it. To achieve this, we must educate ourselves, and one strategy will be to implement this training and resource in undergraduate programs.
Perfect. Yeah, totally agree. I would add only that I like this mindset of collaborating with others. So I like, for example, the work that Ernesto and Jordi are doing because they are collaborating with other professionals that have the same objective of improving patients' health. So not only we don't need only to improve or to be engaged with AI in nursing, but also to collaborate with engineers, with healthcare, with medical doctors, and with other professions, because they have some knowledge that we don't have, and we have some knowledge that they don't have. We are the final implementers. They need us. I mean, they can do it, but if they do it with us, the result will be better because the final implementers are the nurses or medical doctors in some of the fields. So, I mean, it's an obvious thing. So don't be afraid, I would say, to collaborate with other professions and to be very competent in this case in nursing, but in your profession, to add value to what you are doing and to the work you will be collaborating with them. Jordi and Ernesto, please, if you want to say in 30 seconds the final idea that you would like to share with the audience, what would they need to know after this session? And yeah, just share with them this, and we will conclude the session.
I think the final conclusion is be open-minded. Just if someone tells you like something really shocking, just don't say no at first. Just think about it, try by yourself, and yeah, all the new knowledge, all the new technology, we need to test that first. And if it doesn't work, okay, it doesn't work, but we don't have to say no. We need to test it before. And yeah, I think just be open-minded with the future. That's one of the most important things.
No, just do things. Just do things. Use the systems. You can go to ChatGPT, to Dell, to other systems. I mean, many, and you can create your own specific, Lincoln Gombedza chatbot, and you can train it, and you can study it, and you can implement it, and by doing, you will be unstoppable, because then you will understand the nuances, the nuance. I mean, if not, it's always PowerPoint. Forget about PowerPoint. I mean, I'm using it because I have to use it. If not, I would prefer not to use it. So do it things, and then you will be on thriving, on the wave. If not, you will be lag behind, because others will do it for you, and that's the point, I would say.
Many thanks, Jordi and Ernesto. We will be closing the session right now. I just wanted to mention that we are the Nursing No Challenge organizations, and you didn't explain it in the beginning, but we are a global initiative that aims to empower and develop early career nurses and midwives, the professional careers, and by improving their careers, we believe that we are improving patients' health. So that's why we like to collaborate together online, and then sometimes even in face-to-face, in person. So, and especially now, you might know that the World Health Organization is going to release a new report on the state of nursing and midwifery. Well, a new state of world nursing report, sorry. And WHO will be doing that in London in 12th May, International Nursing Day. So we will have a lot of that data there with that report. So stay tuned about that report, about that launchment, because once we have the data, then we can start thinking about, okay, what can we do with AI and with some other initiatives, and how can we ask our policymakers to implement those ideas that we have and that we know as final implementers that could improve patients' lives. So that's all. Many thanks for joining us. Many thanks to have here Aisha Holloway, Program Director of Nursing Challenge, and the other regional leads, Marta Ferraz, Ernesto, Jordi, Hannah, and this is everything. Many thanks for the presentation and the audience for coming here.
Thank you very much.
Thank you very much.
And yes, we have the website in the chat. If you want to explore a bit more the Nursing Challenge, you can access the website in the chat. Okay, many thanks and see you soon.
See you.